Hi, how are you going? I hope you're feeling as well as possible on your medicines. I'm Pharmacist Fi. Welcome to my YouTube channel and to video 3 of our series called Medicine Safety, 7 Things You Can Do. Number 3 of the 7 things is to get an interactions check for everything you take, including prescription medicines from the doctor, but also including non-prescription medicines from the supermarket or pharmacy for things like different types of pain, or reflux or heartburn, allergy and travel sickness medicines, sleep, cold and flu medicines, headache, thrush, urinary tract infection, constipation or diarrhea, and more. Plus vitamins, minerals, herbal medicines, herbal teas or supplements, because quite a few of these things may interact with some medicines from the doctor or with some medical conditions. Plus, also include in the interactions check any non-medical drugs if they are currently part of your life, such as alcoholic drinks or products with caffeine in them, like coffee, tea, energy drinks or guarana, or smoking. And include smoking tobacco or cannabis or both, if either applies to you, because these products may interact differently with a range of medicines. And we will look at these things in some separate videos later on. In Australia, your pharmacist should be able to run an interactions check for you, or if you like, you could run a preliminary interactions check yourself on a free website like drugs.com. But if the website tells you that you have any interaction, talk to a doctor as soon as you can to find out whether any interactions may mean medicine changes are needed or not. Because although some interactions can cause life-threatening illness, some other interactions may be mild and not need medicine changes. And depending on what medicines you take, suddenly stopping an important medicine for a really serious medical condition might be much more dangerous than continuing to have a mild interaction in some cases. So my first top tip about medicine interactions is don't try to make medicine decisions on your own. Get the doctor to help you weigh up the good and bad possible outcomes of whether your medical conditions may or may not get worse if you have medicine changes, versus whether there are any risks from a medicine interaction if you don't have medicine changes. Then decide what to do together with the doctor. And if any medicine changes are needed, ask the doctor exactly how to make the changes as safely as possible. For example, if a medicine needs to be stopped, should it be stopped immediately or gradually? And if gradually, how? There are a lot of different ways medicine interactions happen. Here are 2 main outcomes. Number 1, some interactions increase the effects of a medicine. So the risk here may be increased effects, increased side effects, and possibly even toxicity. Toxicity means poisoning. And how risky this is depends on what medicine it is. An example of toxicity risk is colchicine, which Australians may know by brands like Colgout or Lengout. And this medicine is used to reduce inflammation and pain of gout. So an interaction that increases the level and effects of colchicine too high may bring a life-threatening risk of toxicity. So if you take colchicine, always tell every health professional you see that you are taking it. And always get an interaction check done before starting any new medicines. Number 2, some other types of interactions actually have the opposite effect. So they decrease the effects of a medicine. So the risk here is that the medical condition might get worse if the medicine has less effect, which might be really dangerous for some life-threatening medical conditions, like cancer, severe infection, or epilepsy. Interactions are a relatively new area of medicine. So not all doctors and pharmacists know about all interactions because there are literally thousands of possible medicine combinations which may or may not have interactions. So don't be dismayed if your doctor or pharmacist starts looking things up on their computer when you ask them about medicine interactions. What matters is not whether they know all the interactions already, but whether they know how to find out about them for you. Please click subscribe and like buttons below this video if you'd like to see more Pharmacist Fi medicine safety videos. And if there is a particular medicine that you would like to suggest for me to look at in an upcoming video, you are welcome to type the medicine name in a message to me below this YouTube video. Denver and I look forward to catching up with you again very soon. Thanks for watching. Bye. You can go. Good boy. You did well. Yes, you did well. Good boy.